Within EY, we set up a health and mental health strategy there. We saw a huge interest and a huge stigma and change in the topic around mental health, with all of our providers, so occupational health and our health insurance, being used a lot more. Mental health became the primary reason that people went to use these support services and our health providers, and the mental health network grew such that we had a representative in each of our 22 offices. What's surprising is the difference between, well, the stigma's still there, and actually people talking about it and actioning. Also the amount of pushback and the amount of organisational politics you have to wade through to actually implement a sustainable strategy that's really going to change culture. It's very easy for organisations to put in webinars and bits of training, but to actually change processes and how things are done and HR policies, there's real pushback. Well, first of all, it's about want. So there's a lot of talk at the moment about changing the stigma, and yes, that's important, but actually that's part of it. If you really want to make a difference to the health and mental health of your employees, that's actually getting dirty. It's sort of, writing a proper health and mental health strategy. It's looking at your numbers, it's looking at your absence rates, it's changing your providers, it's actually holding your health providers up to making sure they're covering the right things. It's changing your policies, potentially changing your performance management system so it differentiates between low performance and mental health issues, and actually a really structured, hardcore, long-term policy and strategy that covers all of the organisation at every level. So there's been a lot of talk in the last few years about all these great things that people are doing, and we are actually talking about it, but we're not doing. So I think there's a lot of people and organisations talking a good game about having a great policy and how well they treat their staff, but if you actually look at individuals and the behaviour towards them and actually how far they've come, it's a lot more talk and less action.